Bismillahirrahmanirrahim. Assalamu alaikum to all viewers. I, Muhammad Awais, first year professional student of Doctor of Veterinary Medicine at Sindh Agriculture University, Tandoja. And I am very glad to have an opportunity by Dr. Noor Samad for giving me a chance to give a presentation on the bone of hind limb that is known as tibia and fibula, which is also being called zygopodium. Zygopodium means any bone which has two prominence. The one is tibia and the other one is fibula. The other example of zygopodium is radius and ulna. So the topic of my presentation is gross anatomy of tibia and fibula. Tibia and fibula both belong to the category of long bone. Tibia and fibula in case of dog are equal in length. So let's move to each bone one by one. First of all, for going further, I must tell you that why do we call tibia and fibula, not fibula and tibia? Because there is a solid reason behind it that any bone that comes from medial side is named first and the bone that comes from lateral side is named later. So that's why we call tibia and fibula. Tibia is from medial side and fibula is from lateral side. Same like is that radius and ulna. Radius is from medial side and ulna is from lateral side. Now let's come to each bone one by one. This bone is tibia. It has two extremities because every long bone has two extremities and a shaft or body. In the proximal extremity, it is three-sided. In the proximal extremity of tibia, the major part plays in the formation of a steeple joint. What is a steeple joint? A steeple joint is a type of hinge joint that is formed among femur, patella and proximal extremity of tibia. In the proximal extremity of tibia, there are two condyles, two articulating surfaces. These are known as condyles. The lateral condyle articulates with the head of fibula and forms a tibial-femoral joint, and medial condyle articulates with the femoral fossa and forms a femuro-tibial joint. So from these condyles there projects articulating surfaces. These are known as intercondylar eminence, which are subdivided by caudal and central intercondylar area. Intercondylar eminence are small elongated tubercle. Now you can see that these both are intercondylar eminence. This is from medial side, which is higher, and this is from lateral side, which is lower. Means intercondylar eminence from lateral side it is higher, and from medial side it's higher, and from lateral side it is lower. Intercondylar area, it is a shallow, and cranially it has a depression. And in between these condyle there is a popliteal notch from where popliteal vessels passes. That's why we do call popliteal notch. Extensor groove from where long digital extensor muscles passes. From the cranial part of proximal extremity, there is tibial tuberosity where sartorius, bicep femoris and quadricep femoris muscles passes, and distally from tibial tuberosity is cranial border of tibia. Now let's move to the other part of tibia, that is shaft, which is rounded in shape. Now, as I already mentioned that from tibial tuberosity there is cranial border which separates the shaft into two parts, medial and lateral. Medial side is subcutaneous, and the lateral side of shaft where muscles attach. Now move to the last part of tibia, that is distal extremity, which is four-sided and it has articulating surface. These are known as cochlea. The medial cochlea forms the large bony prominence that is known as medial malleolus, and the lateral condyle articulates with the distal end of fibula. So this was all over about tibia, and now this was from medial side, and now there will be attachment of fibula from the lateral side, and the space between tibia and fibula is known as intraosseous space. Now tibia is also a thin long bone which is also known as a calf bone. This bone is fibula. It is also category of long bone. This is thin long bone, so it has two extremities, proximal and distal extremity, and a body. In the proximal extremity it has a head which articulates with the lateral condyle of fibula, and distally it has lateral malleolus. I hope you would have gotten something. I wish you best of luck. Thank you.